here are my 5 cards, and I just took a pain pill like 20 minutes ago, so that's a disclaimer for you. Okay. As most of you guys can probably tell by my swollen face, I just got my wisdom teeth removed, and so I thought this would be the perfect topic to kind of inform you guys about, and the 3 most common reasons that people might get their wisdom teeth removed versus having them stay in. So I went to a ton of different websites and had a lot of research done to kind of pinpoint the 3 most common reasons that people choose to get their wisdom teeth removed. Now, hopefully for you guys, listening to this speech will give you some information, and it may help you decide if you should think about getting your wisdom teeth out or not. So, the first reason that I'll be speaking about is overcrowding. So, overcrowding happens a lot whenever your wisdom teeth are coming in, especially if your mouth is already crowded. Now, whenever I was a little girl, my mouth was already crowded, and that caused me to have to get a ton of teeth removed and get braces whenever I was in the 6th grade. So, if overcrowding is happening, that can cause misalignment, which can definitely erase years of dental work. For me, that would be braces. For other people, it may be different things, but it can move your teeth around, make them crooked. It just causes a ton of problems if you don't have that dealt with whenever you see that that could be a possible reason. So, this causes a ton of problems because your teeth are going back to how they were and they're changing from what you're used to. But another problem can even arise from this that may be a little bit more in your face, and that would be pain. Now, pain can come from overcrowding because your teeth are obviously moving around and they're moving the places that they've been in for a good amount of time. But pain can also come from gum inflammation, and that can come from your teeth coming in, your wisdom teeth. Now, whenever your wisdom teeth come in, sometimes that can cause irritation, your gums can get inflamed, and that can definitely cause a lot of pain in your mouth. However, infection can also occur from your wisdom teeth coming in. Now, sometimes whenever your wisdom teeth come in and it is dealt with later, you're not thinking about it, it's left untreated, that can cause infection because your impacted teeth can cause bacteria between your gums, your wisdom teeth, your gums, your molars, your wisdom teeth, all of that causes infection. Infection causes pain. So, pain and overcrowding are obviously big driving factors to people deciding to remove their wisdom teeth, but there's so many more. However, I'm going to talk about the last one that I think is the most common, and that would be damage to your nearby teeth. So, when your wisdom teeth come in, I think everybody knows that they don't care about your other teeth. They're making room for themselves. Whether they come in crooked or straight, they're coming in. So that can damage the nearby teeth, their neighboring teeth, causing cavities, bone loss. It can even grow on top of your secondary molars, which I think is absolutely crazy. Fortunately, I haven't had to deal with that. But I did have to worry about damage to nearby teeth whenever I saw my x-rays because my wisdom teeth were coming in crooked. So whenever you see that, you do probably want to get them taken out to avoid the damage to your teeth. Other things that I think are a little more rare than just normal damage would be dental cysts. Now this can happen, and if those are definitely left untreated, that can actually spread to the roots of your neighboring teeth, causing damage to those too. So, if you feel like any kind of damage might be happening, you definitely need to figure that one out because you want to deal with cysts or bad damage, bone loss, cavities, etc. So, hopefully, now that you've heard all that information, you can kind of understand the 3 reasons that people might get their wisdom teeth out. Those are the same 3 reasons that I got mine out. First was overcrowding, which can cause misalignment, erase years of dental work, and cause tons of problems. It can lead to pain. Pain can come from inflammation, it can come from infection, from the bacteria, it can come from just the process of your wisdom teeth coming in. Also, damage to your nearby teeth. That isn't always a definite, but it is definitely a possibility and a threat, so you might want to see if that might be a possibility for you with x-rays, because sometimes your wisdom teeth come in crooked, and if that's going to damage your teeth, you definitely want to get that figured out. I decided to have my wisdom teeth removed because I was feeling a lot of pain, and with the x-rays, like I've said, you could see it was going to cause more problems if I left it untreated. So, if you have heard this speech and you think maybe you want to talk to your dentist and your teeth are actually fine, they're coming in straight, good for you. Maybe you won't end up like me, having to deal with the swollen, the pain, the puffiness, and just getting them out in general.